Hello, today I want to talk about osteoporosis. Osteoporosis is actually quite common and has no specific symptoms, so a patient might only come in due to a fracture caused by osteoporosis. It's usually seen in older age, particularly in elderly individuals. Women are more affected than men, and it typically starts after menopause. In men, it usually becomes significant around the age of 60 and above. If there are no underlying diseases, some conditions can lead to osteoporosis, such as hyperthyroidism, hypothyroidism, or parathyroid disease, as well as the use of certain medications, which can contribute to lower bone density. People who are thinner are actually more prone to osteoporosis, and consuming certain foods like soda can also play a role in developing and worsening osteoporosis. It's better to focus on prevention initially, and if it does occur, treatment should start before any fractures happen. People who are thinner are actually more susceptible to osteoporosis, and consuming certain foods like soda can contribute to the development of osteoporosis and worsen it. It's better to focus on prevention initially, and if it does occur, treatment should start before any fractures happen.